And so what we're going to do is we're going to map out exactly the location of the prostate here. The software that we have is it's a very powerful software where it will do a great job of this pre-treatment planning. And hopefully you guys could see this image here where we have the green line outlining the entire prostate. And this line, we can move it, as you're seeing here on the screen, where if there was a little lip of tissue here, we can always move it out to encompass that lip of tissue. But really, that looks good where the way John has it right now. So that outlines the prostate. Then we're going to come in and outline the urethra as well. Again, we have room to play with the exact location of this urethra. So if the urethra were more anteriorly, we could push it anteriorly. If it was more in the center of the gland, we could push it in the center. And we can even change the size of the as well if it were a smaller or bigger urethra. So let's make it a little bit smaller and go up a little more anteriorly. Yeah, right there. Okay, so we've mapped out the urethra here. Next, we're going to map out the location of the rectum. Again, this is just like the rest of software that we could manipulate it so that we're mapping it out specifically to this patient. Okay, so that looks good. So now what this the software is going to do is going to calculate how many probes we should place and the location of this. So again, I think this is a good time. Yeah, you can get it to the place where we talked about earlier.